Hey everybody, I'm Dr. JJ Thomas. Welcome to the Clinical Corner. In the Clinical Corner, I hope to give you tools to be able to fix yourself and any injury-related or at least symptom-related issues you might have. Today, we're going to talk about assessing your forward bend to figure out what exercises are best to improve your forward bend. A lot of times this correlates to like low back issues, more chronic, if you're somebody who has like an acute disc issue or pain traveling down the leg, by all means, please contact a live professional. But if you have this aching low back that you really are looking for some tools to address, that's what we're going to teach you today. So here's the test. We have to do the test to figure out which exercises to give you. The test is if you're someone that has a limited forward bend. So by forward bend, all we mean is that when you stand with your legs straight and you go to touch the floor, you're limited, right? Maybe it's painful, maybe it's tight, maybe you just can't go. A lot of my patients I'm like, what do you get there? Like, I just can't go, You're the person that wants to do this test. What I need you to have is a ball. Any size ball, just not huge, all right? It has to be so that when you put the ball in between your knees, which I'm gonna ask you to do in a second, that your feet width is not much bigger than hip width, okay? It could be smaller, but just can't be much bigger than hip width apart. So first you're gonna measure how far, when you compress the ball, your feet need to be in order to be standardized, okay? Now, the first part of this test though, we're gonna put the ball to the side for a second. You're gonna keep your feet standardized there, and then you're gonna see how far you can bend forward. And maybe you're limited there, right? Maybe, like I said, it's either painful or you're just like, I just can't go. Or a lot of people feel it in their hamstrings here, regardless of the precipitating factor. So maybe you're limited here. Maybe you're not. Maybe you're like, oh, I move great. Then this isn't necessarily the episode you need to watch because that means you don't have a deficit in that pattern. But if you do have a deficit in that pattern, what I want you to check is now take this ball that you have, this kind of scrunchy ball. If you don't have a ball, you could use a pillow, but something that has a little resistance when you give it. I want you to actively push this ball in as you bend forward. If that clears you and now all of a sudden you've gone further than you did without the ball. So without the ball looks like this, standardized feet. And then with the ball, you squeeze. And now all of a sudden something happens, you unlock and you're able to move further. What that tells us is that your limitation is a stability limitation. What we know about the body is, I'm gonna put this over there actually. What we know about the body is filled with protective mechanisms so that if it's not safe to move, it won't let it. So when someone shows me this type of movement pattern and that they improve, when I recruit their adductors and by default their abdominal muscles, it shows me that they have a stability deficit, that if we treat that, even by giving them an exercise, it's gonna help them get better. It's gonna help them move better, and more importantly, it's gonna help their body feel safe to move. So if you had a positive test in these two tests, here's what I want you to do. The first exercise we call froggers. We do them a lot in this. They're actually maybe one of the most prescribed exercises we give at this office because they fix a whole ton of things. But one of the things it helps with is stability patterns. So your feet, for froggers, your feet are gonna be outside your hips. Just outside hip width apart. You're gonna squat down as deep as you can without your heels coming up, okay? That part's really important. Some of you might be down here, some of you might be way up here. It doesn't matter, don't judge yourself. Come into this with a very non-judgmental position. You're gonna just, where you are is where you are. Just make sure that you don't try to force motion through your hips by letting your heels come up, because then you're gonna miss an important part of this step, okay? So, feet are flat, squat down as deep as you can without your heels coming up. Let's just say I'm here, okay? Because I can go here, but most people are gonna be around here. From this, what I want you to do is walk your hands as far forward as you can, again, without your heels coming up. You see how here my lumbar spine kind of opens? Now, I'm in this position, I've measured where my lumbar spine is getting a nice opening pattern. Fingers are spread, elbows have to be straight. And what I'm gonna do is now I'm gonna allow myself to shift off my heels and stack my shoulders over my wrist. I'm gonna push the floor away to engage abdominals and then pop the feet flat forward, sit back and look up. And then we repeat that. Walk the hands as far forward as we can, fingers spread, elbows straight. Allow the heels to come up now. Push the floor away, pop the feet flat forward, sit back and look up. So what we're doing here is we're re-sequencing the way our body moves for that stability pattern. As I showed you with the ball, many people have lost that primal foundational recruitment pattern of firing stabilizers first. And by default, the brain is like, oh no, I can't go any further, I'm not stable. But when you do an exercise like the froggers, what you do is you teach the body, you teach the brain, you teach the muscles to sequence the pattern in the way it's foundationally required to do safely by having the arms from here, fingers spread, elbows have to be straight. If your elbows are not straight, you're gonna fire rotator cuff muscles instead of core stabilizers. Elbows straight. Here, that deliberate push the floor away, that's engaging those abdominals similar to how the ball engaged you to be able to bend forward, and then you're gonna pop the feet flat forward. Now, I'll tell you, some of you listening to this are gonna have such a deficit that you're like, this chick is crazy, I can't even pop my feet forward, so I'm gonna give you a regression right now. What we would do for the regression, still squat down, feet flat, walk the hands forward as far as you can with feet flat, and then you're gonna shift. Now from here, you're still gonna push the floor away further than you think you can. See how that engages my mid-back essentially, my scap stabilizers? And then you're just gonna walk, and then stand. For that one, I will caution you, you're gonna be tempted because we all have this image of what success is in each exercise. And you're all gonna be tempted to, when you go to bring the foot up, you're gonna be tempted to do this. Don't you dare, because then you're just feeding that compensation again. You have to keep that push through the floor. That is the primal, that is the foundational movement pattern. If you miss that, you're wasting your time. So if you had a positive test on that, try that exercise. If you didn't have a positive test on that, so let's back up a second. Let's say you bent forward, you were limited. You put the ball in, you were limited to the same amount. A lot of times that is a limitation in the low back, in that your pelvis is tilted posteriorly. So what we need to do is get lumbar spine mobility for you so you can bend further. So this is the exercise. This one's much simpler. So congratulations to you that fell into this category. So for this exercise, your feet are flat on the floor, palms are down by your chest, and relax the legs, and then head is neutral. Ears are stacked over shoulders essentially. And then you're just gonna use your arms to press up. If you're limited in this pattern, you might only expect to be here, and that's totally fine. You're just gonna go up. If you can get up there, stay there a little bit, maybe shimmy like this, and then come down. Here, shimmy, and then come down. So this one's a real simple one. Go ahead and try it. It's really just gonna give you spinal mobility. And always do your test, retest. That's the way I'm gonna arm you with a little bit more control and understanding over your body and how it responds to these exercises. So after you do any one of these exercises we recommend, please by all means test, retest the test that we showed you, see if it feels or moves differently, and that's gonna give you the understanding of what your body needs to get better. Continue to follow on that path and hopefully you'll see results. Looking forward to seeing you more in the future.